Scenario for Nurse S. Medpass. Mr. Clarence Hughes was admitted on Monday for routine colonoscopy. Upon examination in the pre-op area, he was found to be hypotensive. The physician determined that the bowel prep has rendered him dehydrated and hypotensive. Therefore, the physician has admitted him for observation. With the colonoscopy postponed, he was given 3 liters of normal saline IV yesterday. Currently, he has number 20 PIV in the left forearm inserted in the pre-op area yesterday. It is now Tuesday, and you are administering his AM meds. Vital signs for this morning are as follows: blood pressure 90/60, heart rate 60, temperature 98.6, respiration 18, blood sugar at 8 o'clock was 1:56 p.m. Labs: potassium level 3.2, sodium 145. I and O balance from the previous 24 hours is negative 200 cc's. Weight on Monday 89.7 kilograms. Weight this morning 88.1 kilograms. He is complaining of mild nausea but feels he can take his PO meds. He is not NPO.
Good morning, Mrs. Hughes.
Good morning.
I brought you some water to take your medications with. My name is Kyle. I'm your nurse today. How are you feeling?
Feeling all right.
Good. Can I get you anything right now?
No, I think I'm okay.
Okay. I'm going to wash my hands and I'll go and get your medications ready. And I'll be back and we'll get you to take your 9 o'clock medications.
Okay.
So I was concerned this morning with Miss Hughes' blood pressure and a little bit of fluid, a low fluid balance. She has Lasix ordered for 9 o'clock, but I'm actually going to hold the Lasix right now. She also had a blood pressure that was lower than would be comfortable and a heart rate that is 60, and so I'm going to also hold her metoprolol. She does have a potassium of 3.2, and I know she's mildly nauseated, so I'm going to give her her potassium tablet, but also give her some medication for nausea to settle her stomach. She is a diabetic, and her last blood sugar was 156, so it's okay to go ahead and give her her insulin. So I'm going to start by getting her potassium. And I'm going to make sure that I read and make sure that I do 3 medication checks. So I have potassium 40 milliequivalents, 1 tablet. And I'm going to set that right there just so that it reminds me that I have that tablet. And I'm actually not going to unwrap them until I take them and give them to her. The next medication is Pepsid. And that's 20 milligrams orally. So I'm going to make sure that I have that tablet. And then we have to give her some injectable insulin. So I need an insulin syringe and something to clean her skin with. But I'm also giving her an injectable medication, so we have to swab her IV at the same time. So she has insulin, 10 units of Lantus ordered. So I'm going to make sure that I have Lantus insulin, and I have an insulin syringe, and I'm going to give 10 units. I'm going to have another registered nurse check my dose of Lantus before I give it to the patient. I'm not mixing insulin, so I can go ahead and give this or draw this up on its own. So I have Lantus, insulin, 10 units. Mary, can you check this insulin for me?
Yes, I can.
So I'm giving Lantus 10 units
Okay.
to Miss Hughes on this sheet right here.
Okay, let me make sure. Lantus. Yep.
And her blood sugar was 156 before I
156.
give this.
Okay, great.
Okay, thank you.
Thank you.
The next thing I'm going to do is I'm going to dilute some Phenergan to help with her nausea. So I need a syringe to give the medication in, and I also need a flush syringe so that we can give it through the IV. So the Phenergan is supplied in a glass snap-off ampule, and it's 25 milligrams in 1 cc. So I'm going to break that. And I'm going to drop 1 cc of the Phenergan. Now, I've checked my ampule again, and I'm going to set it there. I'm going to dilute the Phenergan so that it's 1 milliliter of the medication in 9 cc's of the diluent. So that'll give us a 10 cc total. So I'm going to get rid of 1 cc of fluid. Then use my safety tip to inject the medication into the syringe so that it mixes with the diluting solution. So that will be 10 cc's total. I'm going to make sure that I get rid of my sharps. And the ampule so that there's no clutter when I leave my work area. I do have a Sharpie, and I'm going to use my Sharpie to write the dose on the syringe of the Phenergan so that I know exactly how much it is. Okay, so now I'm ready to go to the bedside. I'll get rid of that ampule. Make sure I have all of my stuff to take with me. Hi, Miss Hughes.
Hi.
So I'm back with your 9 o'clock medications. Can I have you state your full name and birth date for me, please?
Yes. Clara Hughes. 07/25/1990.
Perfect. And do you have any allergies that we know of?
No.
Okay, thank you. I'm going to have you take your medications 1 tablet at a time and just make sure that you're okay to swallow them.
Okay.
Do you have a preference for which medication you take first?
Let's start with the largest.
Okay. So I'm going to give you a Prilosec tablet,
Okay.
and I'll get you to hold out your hand. next I'm going to get you to take a potassium tablet.
Okay.
And I'm keeping my wrappers for my tablets so that I know exactly what I've given her. Okay. Great. Did that go down okay?
Mm-hmm.
All right. I'm going to give you your insulin. Is it okay if we use your left arm for that?
Yeah, that's fine.
Okay. You didn't have your last injection in that spot?
Mm-mm.
Okay, perfect. So I'm going to clean this area. We're going to give the insulin. Sharp poke. Does that feel okay?
Yeah, it feels fine.
Good. And I do want to give you a little bit of medication for the nausea just to help settle your stomach.
Okay, good.
Okay. This medication is called Phenergan. And we give this quite slowly because it can actually burn and irritate your veins. Sometimes patients will actually say that they can taste this while you're giving the medication. So I've given that entire syringe over about 2 minutes, and now I'm going to flush the IV with just some saline to make sure that all of the medication is out of the port and that the IV is still patent or it's still infusing properly. And this can be done fairly quickly with some pressure to make sure that the IV is actually working well. Then use the sterile cap to recover it. Okay, thank you, Miss Hughes. I'll be back to check on you in a few minutes to make sure that your stomach is settled and that you're feeling okay.
Okay, thank you.
You're welcome. And I'm just going to make sure that I throw away all my trash and document each of the medications that I gave and the time that I gave them. I'll make sure that I go back and make sure that her stomach is settled, and I'll check on the effects of the medications. Thank you.